Adriana Viola Miranda is a 21-year-old medical student at the University of Indonesia who's in her final year of studies. She has also been involved in several international publications, conferences, humanitarian aid projects, as well as national and regional scientific organizations for which her faculty awarded her the title of Most Outstanding Student in 2019. Driven by her passion to help the medical community and empower the youth during the pandemic, she and her colleagues co-founded a global grassroots movement called Student Against COVID, or SAC, in March 2020. It focuses on spreading credible information regarding COVID-19 and other health issues, as well as facilitating research and innovation. It also fosters collaboration between youth across the world. Currently, SAC comprises of more than 800 members and past members spread across more than 90 countries. She also strives to utilize her passion in medical research and information technology to improve healthcare system across the world. Currently, she is leading an artificial intelligence project for COVID-19 pre-screening that analyzes coughing sounds. She previously won one of MIT's COVID-19 Challenge hackathons, called Latin America versus COVID-19. She won the challenge by creating a project about ML-powered SMS chatbot for patients monitoring. This young woman is eager to contribute something on a global scale. So, let's chat directly with her, Adriana Viola Miranda, only on the C Morning Show.
Yes, it's been a year since the pandemic started. It has pushed a lot of people to try to do good, including the youth. Some medical youth communities have been actively involved in various positive movements, from providing logistical assistance to providing medical equipment. Right, Bon?
Yeah, I think that's, again, it's good to see that the youth take a video, right? In the video that we just saw, we saw how Adriana Viola Miranda strives to contribute more during this ongoing pandemic, right? And it's not only on a local level, but also on an international level, right? She's aiming to make an impact in the healthcare sector, locally and globally, and working with all students across the globe. That's really great.
Yeah, exactly. And now we are connected with Adriana Viola Miranda, or Rian, the co-founder of a platform called Students Against COVID. It is a movement by students and young professionals from 90 plus countries dedicated to stand against COVID-19. Good morning, Rian. How are you today?
Good morning. I'm fine, thank you.
Hi, Rian. I still remember last year in June, you and the rest of the Amigo team won the MIT COVID-19 Challenge. So, could you tell us what kind of initiative that you and your team presented at that time to win this competition?
Okay, so Amigo is an SMS-based system aiming to deliver care in the form of telemedicine to people in rural areas. So as you can see in Latin America as well as in Indonesia, one of the major problems during the pandemic is the fact that people are now unable to go to hospitals without fear of being infected by COVID-19. And so we aim to spread the impact of telemedicine, because most telemedicine platforms only use internet and thus it is unable to access people in rural areas without access to internet. So with an SMS-based telemedicine system, it is now able for the rural patients to also have healthcare in their homes.
Yes, and has this idea been implemented in the real world, currently in Indonesia?
Unfortunately not, because as you can see, our team comprises of many people across the world, and it's been hard to, the time differences is the main issue in actually developing Amigo, but actually we tried to develop Amigo for, I think, about 4 months with mentorship from MIT.
Wow. Now, even though it hasn't been developed in Indonesia, right, we're talking about time, because time is very busy. You guys are all students. how do you manage your time, right? Last year you did the challenge from MIT, and then you're creating this kind of large scale kind of students against COVID platform and volunteering as well. I mean, you must have a busy schedule, Rian. Like, how do you manage your time? Share with us.
Okay, so that's actually quite tricky. um, what I do is mostly prioritizing, making a scale of priorities. So I prioritize things that needs to be done fast. For example, if my exam is coming, then I will do all the other extracurricular activities, and then by 1 week before the exam, I will focus on the exam first. After finishing all the activities, and I think having a schedule and to-do list also helps a lot.
Alright, so schedules and to-do lists as well as prioritizing, that's the key
Yeah.
to her success.
Exactly, and also, despite not being able to implement what you presented in the competition last year, you also and some of other cohort made this movement called the Student Against COVID. So on Instagram. So could you please tell us a little bit about this movement?
Okay, so Students Against COVID is a global grassroots community aiming to provide a collaboration platform between youth and young professionals to mostly to spread awareness about COVID-19 and health-related issues. Currently, we focus on doing online campaigns about children's health, maternal health, mental health, and also about the vaccination program. Aside of that, we also focus on fostering collaboration. For example, we did help some PPE fundraising projects in Zambia, Pakistan, and also the US. And lastly, we also facilitate innovation and research by conducting several trainings and also helping our members publish in journal articles. So we already have several COVID-19 related journal articles published in academic journals.
Right. When you said that you did this online campaign on mental health and on awareness of COVID, how do you measure the effectiveness of doing this online campaign? Because as we know, there is this thing called the clicktivism, where you appear to campaign, but actually the impact is not so much. So how do you measure whether the online campaign that you're doing is actually making a big impact in society?
Okay, so firstly, I think we look at our engagement. So we also see it from our comment section, because I think if people comment, then they also read the post. And lastly, the traction in Twitter is quite high, especially for our translation program. So our flyers are translated into 35 languages, and we've seen positive responses from all across the world. For example, in the US, there are Somali refugees, and since we have the flyers in Somali, many physicians say thank you in their Twitter for our help.
Now, I know, like you said, so you do flyers, you do PPE fundraising, and a lot of good initiatives. And the platform includes more than people from 90 different countries. But how did you connect with them in the first place? How did you manage to establish connection with them? And maybe you can give some tips to other people in Indonesia who are hoping to do maybe similar organizations and connect with people abroad as well.
Okay, so SAC started as a hashtag. So one of our co-founders from the US, named Marina, she is a medical doctor. She posted on March 2020 a tweet with a hashtag Students Against COVID. So the tweet was meant for students to share what they do during the pandemic, how are they helping healthcare workers. And then one of my friends there, so I have a friend from Greece, he replied the tweet, and from then they started thinking that maybe they can start a collaboration platform, and since they are aiming to making this a global community, my friend from Greece, asked me to be a part of it. So Then I went on to co-found the Students Against COVID movement with the others. And then as to how we gain members from all across the world, we partner with a lot of international organizations as well as local NGOs. And we also work by doing mouth-to-mouth campaign and promotion. So we hope that by our members posting on Twitter and Instagram, they can reach more people. They can ask their friends to join, and that's how we grew from a member of six countries to 90 countries right now.
Right. Speaking of the Students Against COVID movement, what is exactly this movement is trying to achieve?
Okay, so we try to achieve. So we are trying to spread awareness mostly about COVID-19 because we know that one of the major problems in COVID-19 pandemic preparedness programs is that many people are not understanding COVID-19, and that has led to many misinformation. So we hope that by making flyers and online campaigns, we can help in curbing that, because we see that the frontline workers are working so hard, and we hope that with our capacity as youth, we can help in some ways. For example, design students, even though their skills are maybe not really match with healthcare sector, they can help by creating engaging flyers so that more people will understand about COVID because, well, firstly, because they are interested in the design, and then they will read, something like that.
So, but it seems that, which is great, it seems that Students Against COVID has also expanded from more just talking about COVID, right? On your Instagram, I can see that you guys have Mental Health Mondays, talking about Alice in Wonderland syndrome, or about depression. You guys even talk about gestational diabetes mellitus, or even estrogen and emotion. So it seems that even the scope is beyond COVID nowadays. Is that correct?
Yes, because COVID-19 is connected not only with the disease itself, but it causes many other health issues. So we are trying to also raise awareness about general health issues, especially those that may arise during the pandemic.
I see. And you seem to also have this interest, particular interest, especially in integrating technology to support public health. So, in your view, Rian, how do you think we can use technology in COVID handling better in Indonesia? How should we rethink about COVID?
I think technology should be used as one of the major solution for COVID-19 pandemic in Indonesia because, for example, platforms like Amigo could increase how Indonesian health system deliver care. And it can be used not only during the COVID-19 pandemic where everyone is at home, but also beyond that. So it can also reach people from rural areas without connectivity. And there are also ways to utilize technologies, other ways to utilize technologies. For example, we can use AI to help deploying healthcare workers to places that are more in need of healthcare workers. For example, in Jakarta, the number of COVID-19 cases is higher than in Kalimantan. So maybe we can deploy healthcare workers in accordance of that number of cases, and artificial intelligence can help that. And there are just endless possibilities with technologies actually.
Yes, and I'm still actually interested in Amigo because unfortunately it can't be implemented right now, right here in the real world, but you actually had that idea and you had that initiative. Could you please walk us through how we would actually use Amigo? For example, I'm a patient, and let's say I am stranded in an island and I need a medical service. So how would I use Amigo?
Okay, so Amigo is actually not patient-based. Our target is hospitals. So basically, during the pandemic, hospitals have one of the major hospital problem right now is to control people with chronic conditions. So as we know that people, for example, with diabetes or pregnancy, they need to go to hospitals every month to get care. But then with the pandemic, people are now afraid to go to hospital. So we would like to serve as a platform that bridges hospitals and patients, especially those in rural areas. The hospital, if they use our platform, will send messages to the patients, messages that check up on the patients. For example, like how are you? How have you been the past month? And based on our calculation, that can help us save millions because with the platform, the hospital can reduce the number of emergency visits because actually the point of going for a medical checkup every month for chronic patients is for them to prevent the emergency visits, and so we hope that we can help the hospitals do that even during the pandemic and beyond.
Wow. Well, Rian, we would love to ask you more questions, but unfortunately we're out of time for today. But again, for those at home who want to follow more about Students Against COVID, you can find them on Instagram at students_against-COVID. And I'm sure we'll have you again on the show, Rian. So thanks again for being with us. Appreciate it. You have a
Stay
great rest of the day.
healthy. Bye.
Thank you.
All right. Well, that was good. That was fun. We got to know a lot more about Students Against COVID and what she's been working on. So it's fun. But anyway, guys, we're going to take a short break. Next up, we'll talk with Yuma Surianto, a 13-year-old boy who loves coding and making apps. So make sure you don't go anywhere. That's going to be an interesting segment. Stay with us here on the C Morning Show.